most common cancers that we see on a daily basis are prostate, breast, lung, and colorectal. Radiation therapy plays a big role in the treatment of these 4 types of cancer, but we also treat many others. We have a very busy palliative practice that involves treating stage 4 cancers that have metastasized to other parts of the body. Pillars of cancer treatment is surgery, chemotherapy, and radiotherapy. And so I represent one of those. And without all 3, we don't have a unified cancer program. When a patient's diagnosed with a cancer, it's a life-altering diagnosis. And we would like to get this patient back to the old normal. Their new normal might be this cancer with treatment and diagnosis and side effects, but we want this patient to get back to the way they were before they even met us. The length of time a patient stays on treatment depends on the type of cancer, what organs are involved, what the outcomes are, what the expectations are. Well, the quality of life depends on the patient's stage of cancer, the organs that we're treating, and the overall condition of the patient even prior to their treatment. Vision RT is a way of monitoring the anatomy so we can manipulate the therapy during the normal respiratory cycle. Because once the treatment is taking place, we do not want any motion. And with this technology, we can monitor the motion if it occurs, and it can interrupt the treatment during the treatment so that we can stop and rearrange the beams or reposition the patient. With this new technology, we will be up to speed with any major cancer center across the U.S. And it's not necessarily technology we would use on every patient. Every patient is going to be individual. So we have the tool at our disposal when it's necessary. The biggest unknown is immunotherapy. And we're just getting on the forefront of it with the newer drugs. But we are going to use the patient's own immune system to fight their cancer in the next level. And that's when vaccines are going to be around the corner, which we're already doing now. And I think that's going to be on the forefront in the future. I got in this job because I wanted to help people, and cancer being a very life-altering diagnosis, it's very rewarding and fulfilling to me to be able to take part in this.